For our submission to the DataVent Pandemic Response Hackathon, the Definitive Healthcare team focused on developing a tool to help with capacity planning and resource allocation. There are going to be a lot of difficult decisions that need to get made about resource allocation, and we wanted to do our part to make sure that those decisions were as data-driven as possible. We leveraged available COVID-19 data and Definitive Healthcare's insights on ICU and ventilator capacity. You can see that I have the tool focused down on the state of New York right now. For each state, we have county by county level. We look at the count of ICU beds per county, Definitive's estimate about the available ventilators in each county, and what that tells us about each county's severe case capacity. We also have a breakdown of the latest COVID-19 cases by county, as well as for the state. This is based on the New York Times Excellent dashboard. From that, we estimate the number of severe cases that are likely to be present in each county. We use the severe cases and the case capacity to tell us what the percentage remaining capacity for severe cases in each county is, as well as how many days we predict until that county exceeds capacity. If we come down to the graph, we can see the data of both cases and estimated severe cases. You'll notice a break in the line here. That's where the data moves from the actual data to the modeling that our data science team has done. If we follow this model out, we can see that we expect New York to exceed its capacity for severe cases by the end of this week. That's in line with what the government of New York has been saying. Let's now go look at a state that hasn't been in the news for COVID-19 nearly as much as the state of New York. I'm going to come to the state dropdown, and I'm going to deselect New York and select Colorado. Once I apply that filter, you can see that we have that same county by county level detail about their capacity as well as their caseload. Coming down to look at the projections, we can see where the data switches from the real counts to our data science model. And if we follow that up to the intersect, we can see that Colorado also looks like they will exceed capacity for severe cases by the end of this week. Our hope is that this tool can be part of the conversation about where to direct resources. Thank you.